Good afternoon. May we all take our seats. Today is Thursday, 15 October 2020. It's a pleasure to welcome us to the national briefing by the Presidential Task Force. It is a pleasure once again to warmly welcome all our viewers, both at home and abroad, to today's briefing. As you're well aware, we're into another phase. This will be unveiled at today's briefing. So we want us to pay close attention as I now invite the chairman of the PTF, who is also the secretary to the government of the Federation, to the podium, as he will now present to us the approval from Mr. President. The SGF, sir.
Honorable Ministers, distinguished ladies and gentlemen, members of the Presidential Task Force, gentlemen of the press, today is Thursday, the 15th October 2020, and I welcome you to the national briefing by the Presidential Task Force. During the last briefing on Monday, the 12th October 2020, I informed you that the Presidential Task Force had compiled all its observations and findings and would in due course present the 8th interim report and recommendations to Mr. President to enable the national response proceed into the next phase. The 8th interim report focused on the primary objective of consolidating the gains recorded in the national response over a period of 6 weeks, which ended on the 13th October 2020. Nigerians will recall that the Presidential Task Force on COVID-19 announced the current measures as approved by Mr. President on 3rd September 2020 for a period of 4 weeks. But due to other exigencies, including the celebration of the diamond anniversary of Nigeria's independence, the phase had to be extended. For the purposes of emphasis and reminder, the Presidential Task Force continues to build on progress made, navigate challenges encountered, and remain on course to achieve the following: slowing transmission, preserving lives and livelihood, and addressing disruptions caused by the pandemic in all sectors of the economy and our lives. Let me at this point avail a snippet of the global situation. As you are all aware, all around the globe, millions continue to be affected by the devastating effects of COVID-19. Many countries in different continents have, however, gradually commenced reopening and adapting to the reality of the pandemic, lasting longer than originally expected. Schools are reopening with strict guidelines. Airlines have commenced flights with enforced advisories, and other aspects of social engagement continue to be gradually reincorporated. The response remains buoyed by ever-increasing global collaboration between and among nations and with international organizations. In-country, public and private sectors have also teamed up to expand the scope of their partnership, especially in resource mobilization, risk communication, and the race to find a cure. I am pleased to add that the PTF has observed and learned great lessons from these jurisdictions and has similarly taken measures to reopen our economy, albeit in a safe and cautious manner. Much as the world is coming to terms with the new normal, emerging statistics indicate that we still have to be cautious, vigilant, by taking responsibilities. As of the 14th of October 2020, the summary of the global situation for COVID-19 stood as follows. 1. Cumulative case count had exceeded 38 million. The United States, India, Brazil, and Russia were recording over 1 million cases. 3. On the African continent, South Africa continues to record the highest case count, with Morocco, Egypt, Ethiopia, and Nigeria following in that order. 4. The reopening of airspaces and other areas of society continued to increase the risk of subsequent outbreaks. 5. Countries in Europe have been experiencing a high level of second wave of infections after reopening their economies. And 6. Some countries are reintroducing stricter measures to control the spread and are confronted by the difficult choices of introducing short national lockdowns or limiting local restrictions. By way of comparison, over a period of 1 month between 13th September and 13th October 2020, the following statistics will show you the changes around the world as depicted in the tables on the screen. If you can see on the screen, I can see that they have already jumped to the chart. But cumulatively, globally, cases from the 13th of September, we had a record case of 28 million plus. 13th of October 2020, that number got to 37 million plus. You can see that in terms of percentages, there was increase of 9 million plus, which represent 32%. On the African region, on the 13th of September, the recorded cases were 1.1 million plus. By the 13th of October 2020, the figure had gotten to 1.237 million plus, an increase of over 120,000 plus, representing 11% increase. Back at home in Nigeria, our figure on the 13th of September were 56,000 plus. By 13th of October, our figure had gotten to 60,655. Clear increase within a period of 1 month of 4,399, representing in terms of percentages, 8%. Similarly, the same thing with death toll. Globally, on the 13th of September, there were 917,000 plus fatalities. By the 13th of October 2020, that figure rose to 1,081,000 plus fatalities, a clear increase of 164,415, representing 18% in terms of percentages. If you look at the statistics on the African continent, on the 13th of September, our fatalities were 23,000 plus. By the 13th of October, it rose to 27,000 plus, a difference of 3,624 representing 15% in terms of percentages. In Nigeria, it was 1,082 on the 13th of September. On the 13th of October, it rose to 1,116. In numbers, 34 fatalities, which represents 3%. This gives you a clear picture of where we stand globally, on the African continent, and in Nigeria. In Nigeria, the Presidential Task Force continues to rely on data, research, science, and experience of other nations to inform decisions at all stages. Our national response to COVID-19 remains targeted at achieving the purposes of epidemic control through reduced transmission and minimizing mortality among the vulnerable parts of our population. Till date, Nigeria has sustained the substantial successes earlier recorded, although statistics show that this pandemic is now slowing down globally. The number of recorded cases in Nigeria have remained between 100 and 200 daily for the last 4 weeks, with a progressive fall in the case fatality rate to 1.9%. The reduction in the test positivity ratio to less than 5% further corroborates the belief that the pandemic curve is flattening, despite the unsatisfactory testing rate in the country attributable to general apathy among the populace. The graph on the screen illustrates the case fatality ratio. As at October 14, 2020, the vital information generated in Nigeria includes the following. 1, number of confirmed cases of COVID-19 stood at 60,834. Total active cases, 7,575. Number of fatalities, 1,116 deaths. Number of recovered cases, 52,143. Cumulative number of samples tested, 567,857. Number of laboratories established, 69, with at least one in each state. States that have achieved the testing target of 1% of population are FCT has achieved that, and Lagos closely followed by 3 states that have crossed 50%. 26 states yet to reach 25% of testing target. The testing target is 1% of the population of each of the subnational jurisdictions. Presently, there is a molecular laboratory for COVID-19 testing in every state of the country, and the additional funding provided by the federal government should help to scale up testing for COVID-19. The PTF has concluded arrangements to test additional 100,000 at the various NYSC orientation camps nationwide when they reopen soon. I understand the management of NYSC has already announced a date, the 10th of November, for reopening. And lastly, over 27,000 international passengers have arrived in Nigeria since the resumption of international flights when we opened our international airspaces. It is, however, important to draw the attention of Nigerians to the following significant areas of concern, notwithstanding the seemingly improving numbers. 1 is the low level of sample collection by states. 2, increasing apathy, skepticism, and disbelief that still permeates police. 3, very low compliance with non-pharmaceutical guidelines by Nigerians. And 4, low risk perception leading to low sample collection rate and decreased testing. If we must avoid a second wave and continue to dampen and flatten the curve, it is imperative for us to jointly address these concerns, and the PTF will continue to appeal strongly for collaboration and for all hands to be on deck. Over the last 6 weeks, the Presidential Task Force carried out activities to boost our case management capacity both in hospitals and at home. This has resulted in increased risk communications and community engagement activities alongside collaboration with most state governments. The reopening of the international airspace has been largely successful, with most passengers following the laid-down regulations and adhering to testing requirements. We have not seen a spike of cases since the reopening of the airspace. The Presidential Task Force, however, noted the huge challenge posed to our national response by states as a result of poor engagement, which manifests strongly in the form of low level of sample collection across the country. As at date, like I said, only the FCT and Lagos have achieved the targets of testing 1% of its population, followed by 3 states that have crossed 50%. And these states are Plateau, Gombe, and Rivers states. 26 other states are yet to measure up to 25% of the population, up to 25% of 1%, because the target is to test at least 1% of the population of every subnational jurisdiction. This is considered a serious problem, which is further compounded by the increasing general apathy and disbelief among the risk or about the risk of COVID-19 in Nigeria. After a careful review of the national response, the Presidential Task Force believes that while recent numbers point to a likely flattening of the curve, consistent with emerging epidemic control, Nigeria is not yet ready for full reopening of the economy. It has accordingly recommended, and Mr. President has approved, the following. 1, that Nigeria further relaxes the restrictions in the 3rd phase of the response while maintaining key limitations to curb the risk of a spike in cases. The major changes proposed by the Presidential Task Force are as follows. 1, gradual and safe reopening of schools and the NYSC camps. 2, recommencing of sporting leagues, in particular all outdoor activities such as football. 3, sustaining the midnight to 4 a.m. curfew or movement nationwide. And 4, removal of the limitation on civil servants allowed to come back to work. In this particular area, the segment of the civil service that had hitherto not been allowed to come back to work are now, with effect from Monday, allowed to come back to work. Other measures approved by Mr. President include 1, maintaining the 3rd phase of the national response to COVID-19 for a period of 4 weeks with effect from 00:01 a.m. That's 1 second after 12 midnight on Monday, 19th October 2020, in line with amendments to address economic, socio-political, and health considerations reflected in the table above. Sustain engagements with states and local governments to improve community sensitization and sample collection. 3, continue to monitor the impact of school reopening and the commencement of international travel and enforcing compliance with the protocols set out for safe resumption of these activities. And 4, maintaining the already established non-pharmaceutical interventions nationwide in order to flatten the curve. And for the purposes of reminder, the non-pharmaceutical interventions are the wearing of masks properly, not chin mask, but face mask properly, maintaining social distancing, keeping basic hygiene of hand washing or the use of sanitizers, and except necessary, avoid crowded environments. Don't travel except it is utmostly important for you to travel so that you can keep safe. The national coordinator would elaborate on the details of some of these measures, particularly with the category of civil servants that will be allowed to return to work on an alternate basis. Not all of them will come in on the same day. We have prescribed so that we can maintain social distancing in their places of work, that the chief executives would introduce processes and take responsibility to ensure that they comply with the non-pharmaceutical interventions and also alternate the days of their reporting in their places of work. Before I close this remark, let me join the whole world to mark the Global Hand Washing Day and to emphasize that it is more important than ever before to keep our paws and our hands clean in this fight against COVID-19 pandemic. I now invite the national coordinator to elaborate on the next phase and its guidelines. And I thank you for your kind attention and listening, and have a good evening.
The Chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. As stated by the Chairman, we are in the process of relaxing the third phase of the response. The PTF has reviewed the month of October under the national response. Our major priorities at this phase of the third response are to continue using data and science to inform decision-making, improving the efficiency of response activities, and emphasizing personal responsibility of individuals in preventing transmission. We know that significant progress has been made in achieving the objectives of slowing transmission, preserving lives, and addressing disruptions caused by the pandemic. However, the level of compliance with non-pharmaceutical interventions does not support a complete relaxation and easing of restrictions at this time. We have used the following criteria to evaluate the success in this phase of the response. This included sustained reduction of new cases nationwide, increased sample collection and testing rates, a reduction of the death rate to less than 1%, a reduction of the test positivity rate to less than 5%, and the placing of measures to manage potential secondary outbreaks. It is therefore the informed recommendation of the PTF that Nigeria maintains phase 3 of the response with further changes to address economic, socio-political, and health concerns. In this regard, and effective from Monday, 19th October 2020, a minute past midnight, the following guidelines will come into place. These recommendations are made in line with our 3 established thematic areas, movement, industry and labor, and community activities. We have developed guidelines with the NCDC and NYSC in the preparation for the reopening of the orientation camps on the 10th of November 2020. The PTF has also arranged for additional safeguards to include the testing of all corpus and staff in the camps for COVID-19 prior to commencement of the orientation programs. It is also time for schools to open, but to open safely. And in this regard, we have continued with providing guidelines and engagement with states to ensure close supervision and oversight as schools open. The lifting of restriction on outdoor sporting activities, including football, is in line with earlier consultations with the Federal Ministry of Youth, Sports Development and the NCDC. However, this is limited to the actual sports itself, not with mass gatherings. So in this regard, mass gatherings, including at sports events, is still restricted, as these represent an opportunity for the virus to spread with an increased risk of a second wave. For gatherings in enclosed spaces, this will continue to be limited to only 50 persons with physical distancing and compulsory wearing of face masks, except for workplaces. The PTF also believes that it is now time to allow civil servants of all grades to resume work safely. Additional guidance will be provided to heads of MDAs. Chief executives and heads of MDAs are responsible for ensuring the strict enforcement of non-pharmaceutical interventions and making sure that the work environment is safe for their staff. Face masks are expected to be worn in every public building, including government offices, and the PTF expects the chief executives to make sure that this is enforced. We also expect temperature monitoring at points of entry into government offices, as well as the availability of hand washing or hand sanitization facilities in every government building. For civil servants that are resuming from Monday, those below the grade level of 12, the MDAs should make arrangements to ensure physical distancing and avoid overcrowding. The PTF is recommending that they should resume and have alternate day attendance rather than everybody going to the office at the same time. The further relaxation of restrictions at this stage of the response will require additional safeguards, and these include the close monitoring of the impact of reopening schools and airports for international travel, supporting states in developing and improving sample collection sites, continued engagement of states that have low sample collection rates, enhanced surveillance across the country, coupled with piloting of new rapid diagnostic test kits, and monitoring the utilization of funds provided to the 32 states for COVID-19 related activities. I will now expand on some of the key issues that have to do with the relaxation of this phase of the response. For general movement, the curfew remains from 12 midnight to 4 a.m. There are no formal restrictions of movement outside these hours, but the risk still remains, and therefore vulnerable persons are strongly advised to continue to avoid unnecessary contact, particularly mass gatherings or leaving home, to protect themselves by continuing to remain away from the general public where possible. For air transport, aviation services have now fully resumed. Guidelines for international travelers are in place. Only travelers and airport staff to be allowed into airport structures. We continue to work on improving the portal. We will also continue to work with the state governments to ensure more and more private laboratories come on stream so that the cost of testing for travel continues to come down. The generation of QR code, the barcode, following the use of the portal will be made compulsory for admission into the country. But the QR code can be generated without payment, either as a temporary code or after payment as a permanent code. We expect all passengers from next week to start using the QR code and uploading their COVID-19 PCR results, as well as filling the health questionnaires online, because we will be moving away from the use of paper at the airports. For land and rail transport, there are no limitations on inter or intrastate travel, but all vendors and service providers must abide by stated stipulations from the Federal Ministry of Transportation and ensure that all NPI measures are applied. I have already spoken about the arrangements in the public sector for the resumption of offices, including MDAs, and all offices are requested to ensure they are ready to receive their staff by this coming Monday. For communal commercial spaces, the PTF will continue to push for the institutional ownership of the response. In other words, store owners must take responsibility for compliance with non-pharmaceutical interventions, and facility owners and managers must ensure that physical distancing is observed, as well as the provision of hand sanitizers and hand washing facilities, including the mandatory use of face masks. We will continue to insist on the policy of no mask, no entry, and no mask, no service for communal commercial spaces. For the hospitality and entertainment facilities, hotels to remain open, but observe all non-pharmaceutical interventions. Amusement parks, gyms, and cinemas to continue to operate at half capacity. Event centers with outdoor spaces to remain open. Eateries and restaurants to open only for outdoor seating services. Bars, lounges, and nightclubs to remain closed till further notice. The National Youth Service Corps, we have already put in place arrangements to allow the opening of the camps, and I will be talking about this in greater detail next week, Monday. For schools, we continue to work with state and local authorities to ensure that guidelines are in place for the safe reopening of educational institutions in line with COVID-19 protocols. We continue to strongly recommend that this opening is done in phases and carried out in stages to ensure that our students are not put at increased risk, and neither are their parents, grandparents, or relatives that are vulnerable are placed at greater risk. So educational institutions to continue working with the state governments to ensure the safe opening of these schools. There's no change for the religious places of worship. The advice remains the same. And for gatherings, we continue to limit this to 50 persons in enclosed spaces, provided physical distancing rules are followed. But in general, outdoor gatherings are preferred. For hospital visits, we advise that visiting sick patients is limited to only immediate family members. the details of the relaxation of the third phase of the response will be published in all social media and normal conventional media for the public. Thank you.
Thank you very much, National Coordinator, for that detailed, who may be here for the first time. Usually, when we have a new phase of this nature, we would like you to restrict your questions only to what has been discussed by the chairman and the explanation by the National Coordinator. So we're now moving to the next phase of having our colleagues ask the questions. We now take the first person on the line.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News, and of course, the two quick questions to the National Coordinator, Dr. Sani Aliu. Well, now that you have said all civil servants can resume work, what about pregnant women in the civil service? Are they allowed to resume? Let's get that clarification from you. And also, now that the NYSC camps are going to open, let's say, of course, we're going to test all of them like what you've said. Those who test positive, will they be sent home or will they be isolated in the camps? Thank you.
The Chairman, members of the task force, my colleagues, good evening. My name is Nancy Oyedia Oron from AIT. I'd like to direct my question to the Chairman of the PTF. In your speech, sir, you mentioned that we'll be having testing week to ramp up testing. So I would like you to specify when exactly is this testing week going to commence, and how many Nigerians are we looking at to capture for this test? Now, what are the strategies that the PTF may be coming up with to ensure we capture as many Nigerians as possible? Because as it stands, a lot of people believe that there's no more COVID-19 in Nigeria. So I want to know your strategy for the testing week. Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the SGF. It's a good thing that we are now relaxing to get to the new normal, and I believe more Nigerians will be consigned on enforcement and compliance and monitoring as captured in item 17 of your address, sir. In view of the fact that most states have now relaxed protocols, and unconsciously, and just what my colleague said, I want to align with Nancy. Now, for the coordinator, sir, with some numbers rising amidst further relaxation of restriction, is the PTF planning for the possibility of a second wave and the impact on the already opened part of the society? Thank you very much.
Yeah, my question is for the National Coordinator. There isn't, I'm sorry. My name is Gloria Umhizeke from Channels. So there isn't yet a clear sense of what the government is doing to actually sanction those who flout the rules. You mentioned a lot of sanctions and those who should, obey these things. How are you? What are you doing, to ensure that this is obeyed to the letter? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo of the Sun newspapers. I have just one question for the coordinator. I'm interested in knowing why every other sector of the economy has sort of opened up, but bars and nightclubs have remained closed. Why? Do you have anything against them or something? They drink alcohol. She drinks alcohol.
Good evening, the chairman and members of the PTF. My name is Mitai Reikben. I report for the NTA. I have no doubt that the National Testing Week whenever it will hold, will reveal a preponderance of COVID-19 cases in the country. If this eventually happens and we have a surge or resurgence of cases, will there be a second lockdown like what we are witnessing in a few countries of the world? And as it is at the moment, we are beginning to experience relative resurgence or rise in cases in the last few days. What is the PTF's reading of this situation in terms of the probable cause of rise in cases? Thank you.
Thank you very much. Those were the questions. I will invite the DG and CDC to be followed by the national coordinator and then the chairman of PTF. So let's take first the DG and CDC.
So thank you, gentlemen of the press. The few questions I'll take the question on the National Testing Week. We will execute that after the major operations we're planning around the NYSC camps. So we're right now focusing on the significant logistics related to testing everyone coming into every camp at the same time in every state in Nigeria. Huge logistical exercise, both for testing, for providing IPC, PPE, commodities, and making sure we are prepared for that. So that's the first operation. Then we will take on the National Testing Week immediately after that. What other question? For the NYSC camp, where the testing week, we haven't really defined the number of people yet. It will depend on the population in each school, in each state, and that will then define the number of people we'll test. But the key thing, Mitare asked a question in terms of understanding the second wave. One thing is happening already to understand the burden of infection in Nigeria is the seroprevalence survey. We're doing it in 4 states already, and we're going to do it in 2 more states to the end of the year. That will really give us a good idea of the burden of diseases in the country right now. You see, even when we carry out the testing week, it will not determine the number of new cases. The number of new cases we'll have will be determined by our own behavior, right? And the circumstances that we find ourselves in. So right now we're reopening schools, and schools, by definition, you are going to have more people in confined spaces. We've published guidelines together with the Federal Ministry of Education to mitigate those risks. How effectively they're implemented will then lead to either more transmission or less. You can see some of the demonstrations happening across the country. The virus doesn't know whether you're young, you're old, whether you're a policeman or whether you're a demonstrator. It uses the opportunity to jump from person to person. So we continue to advise everyone, wherever you are, to wear masks. You can still have your voice heard if you're wearing a mask. So whatever circumstances you are, whether you're managing a school, whether you're managing an NYSC camp, or whether you're outside, the important thing is to continue to carry out these public health measures. My final point is, yes, there's a lot of reporting about the second wave in many countries around the world. But a second wave is not inevitable. And it will not happen here just because it's happening in Europe. It will only happen here depending on our own behavior and our own ability to manage this. So as we open up our offices, really the onus is on the leaders of each office, whether you're chief executive of an agency, or whether you're the most senior government official in a room, in an office space with other people sitting with you, who will determine whether you come into that room with a mask or whether you're allowed to come in without a mask, who will organize in that setting whether there are sanitizing facilities in that room or not. So a lot of leadership will be required by people as we go into the next phase of easing the lockdowns. So thank you very much.
So DG and CDC has answered a few of the questions, so I will probably skip them. First of all, Amaka asked about pregnant women. So yes, so pregnant women are allowed to resume work as well, in the same way that they would without COVID. What is important is for them to continue to make sure that they follow those precautions that we have always advised for the general population. In other words, wearing a face mask, hand washing, maintaining distances, etc. And a major principle of infection control is to assume that whoever you meet has COVID and act in that way. Because if you do, you will keep yourself safe. So that's something that's really important, because we've been asked the question as to whether people should be tested for COVID, or civil servants should be tested for COVID, etc. But even if we did that, it's only useful for that particular moment in time. Subsequently, people can pick up COVID the next day, 2 days, 3 days later. And what's important is our behavior. In terms of the NYSC camps, yes, so we have come to an agreement with NYSC that all those diagnosed as positive for COVID will not be penalized in terms of not attending orientation camps. So, but they will be isolated, they will be treated in the same way as anybody else found positive in the community. So if within the state the policy is for them to be put in an isolation center, they will be moved to an isolation center. They will not be kept within the NYSC camps, because it defeats the purpose. So they will be taken out and they will be isolated for the period, yes. And every state does have, virtually every state has an isolation and treatment facility now, thanks to the generous donation of COVID. Virtually every state now has some sort of shelter where the persons with COVID can be isolated and treated if need be. The other thing has to do with planning for a second wave. Yes, so we keep on monitoring. We are looking at the numbers. What I would caution, though, is small changes in the numbers, because if the number of samples increases in a day, you will find some changes within in terms of the positives. So I wouldn't necessarily say that the figures over the last 2 days have dramatically changed at all. You would still find the usual slight fluctuations on a day-to-day basis. What is important is measuring the trend over a period of time. If the trend continues to go up, that's when we get worried. There are certain decisions we've taken, such as opening the schools. More than, well, it's actually mostly opening the schools and the issue of orientation camps more than international travel that poses a significant risk in terms of a second resurgence. But the PTF will continue to monitor things very closely. We did have a question about, should we go for a second lockdown if we have a surge? All I can say is hopefully we will not have a second lockdown. But government has its own responsibilities as far as the health of its citizens are concerned. And the PTF will not shy away from taking difficult decisions if there is a need for such decisions. There was a question about what are we doing to ensure sanctions. So we have had sanctions in the past. We've had an event where somebody came to Abuja and broke our rules, and we followed that person all the way to Lagos, brought him to Abuja and sanctioned him. But having said that, it's all about personal responsibility. We are all in this together. The police cannot be everywhere. The enforcement authorities cannot be in your house. They cannot be in your schools, etc. So it's all about the general public and ourselves understanding our risks and the need for us to protect ourselves and protect our loved ones from catching COVID. It's all about behavioral change, understanding the risks, and knowing that the risks continue to be there. COVID is still very much around with us. We are pleased that the death rates have really gone down. But nevertheless, people will still die from COVID for weeks to come in the country. I'm definitely sure of it. So we have to protect ourselves by wearing face masks. In a way, you are saying that you care about the people that you meet, you care about the people that you live with, and you do not want to bring anything home that would end up harming your family or your loved ones. Bars. Nightclubs, I have nothing against them. Not that I drink, but I don't see anything wrong with people going to bars and nightclubs. However, because of the nature of the environment, it's an enclosed space. There are no windows. People are standing very close to each other. We are yet to have a mask that would allow you to drink without taking the mask off. So you are at increased risk of transmission. So that's why, and even globally, when numbers start surging, look at the news. The first thing they say is bars will close. So that's why we are being very careful. The national response that we have run in this country has been very calibrated. We have looked at every single risk and then take a decision. Some of the things that we come out here and say, this should not happen, this should happen, they are not easy decisions. They required a lot of negotiation and arguments and looking at the data, etc., before we come out and say bars and nightclubs remain closed. But they do remain closed for very good reasons. And at a point in time when we are very confident that we are at the right time to relax further, we will open up. So for those of you that love nightclubs, please just be a little bit more patient with us, and eventually, hopefully, we'll all get back to normal. I think that's the last question. Thank you.
We now invite the SGF, who is also the chairman of PTF.
No questions for me. Okay, thank you. But just to add my voice to a couple of issues that have been raised. Mr. Ray, the truth about it, I quite agree with Dr. Sani and Dr. Chukwe that we will determine whether there will be another lockdown. It's entirely the decision of our people as to how we respond to this. And rightly, Dr. Sani did say that government has a responsibility, even in these very difficult times, to balance life and livelihoods, and also to protect the well-being of the citizens of the country. That's a primary responsibility the government has, given to it by the Constitution of the Federal Republic of Nigeria. I will not hesitate to come with recommendations for Mr. President's approval as to how to proceed if we perceive any form of danger that is eminently coming to the people of the country as a result of our conduct and non-compliance with the pharmaceutical interventions that have been put in place. And that's why we keep urging the people to take responsibility. I was at an event in the National Assembly today, and I was insisting on social distancing. I was also insisting that people should wear their mask properly, not for any other reason, but to make sure that we do not have a cluster of infections in those kind of sensitive areas. When it happened in the White House in the US, in spite of the established institutions and structures that they have had over the last 300 years, for those of you that care to follow the news item, there were interrogations as to whether that infection did not constitute a national security risk. So it's a very, very serious business. And I believe that going forward, we'll continue to appeal to the people of our country that taking responsibility is a task that each and every one of us must bear. Madam Son, we have nothing against beer parlors, mama put, nightclubs, lounges, but you know the nature of those places. For obvious reason, they are constructed in such a for effectiveness of either the lighting or the music.